Lymphoproliferative disorders are abnormal growths of lymphocytes. And lymphocytes are kind of like the brains of the immune system. And generally speaking, when they become cancerous, that's either lymphoma or some forms of leukemia. Lymphomas and leukemias, specifically chronic lymphocytic leukemia, tend to be mature B cells. So B cells are the cells that make antibodies. You make antibodies to fight off flu, E. coli, salmonella, all these things. Lymphoma is the cancer of those cells that produce those antibodies. I think the most common way somebody comes in is notice a lump in their neck, or maybe they're in the emergency room for something unrelated and they get a CAT scan and whoa, there's an enlarged lymph node. That leads to a set of diagnostic interventions. Lymphomas have a diversity of clinical behavior. There's some that are incurable but very manageable. Patients who can have these for 10 to 20 years and never even require treatment for them, which is so different than what we think of cancer, all the way up to cancers that are immediately life-threatening. But understanding that context of what makes them different also then is a good segue to why we treat them differently and how we treat them differently, and whether we treat them at all, because some don't even require therapy right up front. The web is scary. There's a lot of good information, a lot of bad information, and it can all look about the same at the surface level. Really relying on your doc to help sort out what's real and what's not, I think, goes a long way.